In the realm of healthcare, where science and compassion intersect, effective communication serves as the bedrock of patient care. Yet, this communication can be fraught with challenges, especially when cultural differences come into play. Imagine a doctor who doesn't understand a patient's cultural beliefs about illness, or a patient who feels misunderstood due to language barriers. These scenarios underscore the critical need for cultural competency in healthcare. Cultural competency, in essence, is the ability of healthcare providers to recognize and respect the cultural backgrounds of their patients, ensuring that care is delivered in a way that is sensitive, effective, and equitable. Cultural competency is not merely an abstract concept, it's a vital aspect of providing quality healthcare. When healthcare providers approach their patients with cultural sensitivity, they foster trust, improve communication, and ultimately enhance patient outcomes. In a world where diversity is increasingly the norm, cultural competency is no longer optional. It's an imperative. Cultural competency, at its core, is the ability to understand, appreciate, and interact effectively with people from cultures different from our own. It's about recognizing that each patient is an individual shaped by a unique set of values, beliefs, and experiences. These cultural factors can significantly influence health behaviors, perceptions of illness, and treatment preferences. For instance, a patient's cultural background might influence their views on traditional medicine, mental health, or end-of-life care. Cultural competency equips healthcare providers with the knowledge and skills to navigate these differences with sensitivity and respect. It's about building bridges of understanding, recognizing that healthcare is not one size fits all. The absence of cultural competency in healthcare can have far-reaching consequences. Misunderstandings stemming from cultural differences can lead to misdiagnoses, treatment non-adherence, and poor patient outcomes. Patients who feel misunderstood or disrespected may delay seeking care, leading to more advanced illnesses and poorer prognoses. Moreover, a lack of cultural competency can perpetuate health disparities, where certain racial and ethnic groups experience higher rates of illness and death compared to others. By embracing cultural competency, healthcare providers can help address these disparities and create a more equitable healthcare system for all. Section 4. Pillars of cultural understanding: knowledge, skills, and encounters. Cultural competency is not a destination, but rather an ongoing journey of learning and growth. It involves developing specific knowledge, skills, and attitudes that enable healthcare providers to provide culturally sensitive care. This includes awareness, recognizing one's own cultural biases and assumptions; knowledge, understanding the health beliefs and practices of diverse cultures; skill, developing effective communication strategies that bridge cultural differences; encounters, seeking opportunities to interact with people from diverse backgrounds; desire, cultivating a genuine desire to provide culturally competent care. By embracing these components, healthcare providers can move beyond simply acknowledging cultural differences to actively incorporating cultural understanding into their daily practice. Section 5. Cultural competency in action: real-world examples. The principles of cultural competency can manifest in various ways within healthcare settings. For example, language access, providing interpreters or translated materials to ensure effective communication with patients who speak different languages. Culturally tailored education, developing health education materials that are linguistically and culturally appropriate for the target audience. Faith-based initiatives, partnering with faith-based organizations to deliver health services in a culturally sensitive manner. Community health workers, employing community health workers who understand the cultural nuances of the communities they serve. Cultural humility, approaching each patient interaction with humility and a willingness to learn from the patient's unique experiences. These examples highlight the practical application of cultural competency principles and their potential to improve healthcare delivery for diverse populations. Section 6. Narrowing the gap: cultural competency and health equity. Health equity is achieved when everyone has a fair and just opportunity to be as healthy as possible. Cultural competency plays a pivotal role in advancing health equity by addressing the social determinants of health, which are the conditions in which people are born, grow, live, work, and age. These conditions can have a profound impact on health outcomes and often disproportionately affect marginalized communities. By understanding how cultural factors intersect with social determinants of health, healthcare providers can better address health disparities. For instance, understanding the historical trauma experienced by certain racial and ethnic groups can inform more sensitive and effective approaches to care. Cultural competency helps to dismantle systemic barriers and create a more just and equitable healthcare system. Section 7. Cultivating cultural humility. A journey of lifelong learning. Developing cultural competency is an ongoing process that requires continuous self-reflection, education, and engagement. It's a journey of lifelong learning, and it begins with cultivating cultural humility. Cultural humility involves acknowledging that one's own cultural perspective is not universal, and that there is always more to learn about other cultures. Healthcare providers can foster cultural humility by self-reflecting, regularly examining their own biases and assumptions, seeking education, engaging in ongoing training on cultural competency and health equity, building relationships, developing meaningful relationships with people from diverse backgrounds, listening with empathy, approaching patient interactions with empathy and a willingness to listen and learn, advocating for change, using their voices to advocate for policies and practices that promote cultural competency and health equity. By embracing cultural humility as a guiding principle, healthcare providers can create a more inclusive, equitable, and just healthcare system for all.